Abang, saya dapat pregnancy test. Dan keputusannya positif.
Alhamdulillah. Betul ke ni? Kita dah 2 tahun tunggu tau.
Ya, betul.
Esok jom kita pergi buat check up kat hospital.
Okey.
Ya Pak Aina, ada masalah apa?
Saya dah 3 bulan tak dapat fikir. Saya dapat pregnancy test ni. Keputusannya positif. So, saya datang ni nak buat pemeriksaan lagi lah.
Okey Pak Aina, kita perlukan pemeriksaan pelvis terlebih dahulu. Saya akan mengambil sampel darah dan melakukan ultrasound untuk membantu diagnosis. Maaf Pak Aina, puan sebenarnya tak mengandung.
Tapi doktor, berdasarkan test tu positif.
Saya dah dapat ujian darah dan saya mendapati tahap hormon puan tak stabil. Kadang-kadang ia boleh berlaku disebabkan keputusan yang palsu. Puan, saya cadangkan untuk membuat pemeriksaan fizikal terlebih dahulu, okey? Adakah Pak Aina mengalami period tidak teratur?
Ya, doktor. Kadang 2-3 bulan baru datang.
Ada masalah jerawat dan tubuh bulu berlebihan, terutamanya di bahagian muka, kaki dan bahagian perut.
Ya, saya pasal nak buat bulu-bulu halus dekat dagu saya.
Mood selalu berubah.
Ya,
Rambut semakin menipis. Pernah naik berat badan dan susah untuk kurangkan?
benar.
Baiklah, berdasarkan sistem tersebut, saya mendapati Pak Aina mengalami PCOS.
What is PCOS? Polycystic ovary syndrome is a hormonal disorder common among women of reproductive age, characterized by irregular or few menstrual period, high level of non-hormone known as androgen, and the presence of many small cysts on the ovaries. These cysts are immature follicle that fail to mature and release age, which leading to distracted ovulation. One of the primary abnormalities in PCOS is the abnormal release of GnRH. Instead of being released in a regular cyclic manner, it is released at a higher pulse frequency, due with increased pulse frequency, which lead to an increase in LH over FSH. This lower FSH causes follicle not maturing enough to become functional and can ovulate. If the follicle does not ovulate, a corpus luteum is not created. Without a corpus luteum, there is no surge in progesterone. The lack of progesterone lead to higher pulse frequency seen in the PCOS. The follicle that don't ovulate are cysts that form on ovary with PCOS. Multiple cysts on the ovary represent past failed follicle ovulation event and also have excessive LH level that stimulate the testosterone to produce high amount of male sex hormone, androgen or testosterone. First, insulin resistant. Many women with PCOS have insulin resistance, means their body does not respond well to insulin. This causes the pancreas to produce more insulin, so it affects the testosterone of the ovary and cause even more androgen release. The high amount of androgen causes decreased sensitivity to insulin. Second, hormonal imbalance. Women with PCOS often have high LH and low FSH. This imbalance prevent normal ovulation and lead to the formation of cysts. Increased LH also stimulate excess androgen production, causing symptoms like acne and excess hair. Third, lifestyle and environment factor. High calorie and high sugar diet, sedentary lifestyle, and obesity contribute to PCOS. Environmental pollutants such as endocrine disruptive chemical like BPA, cigarette smoke, and air pollution.
Jadi Encik Hakim, boleh saya tahu berapa lama anda sudah berkahwin?
Kami sudah 2 tahun berkahwin doktor. Kami sedang cukup untuk dapatkan anak.
Dalam kes ini, kita perlu periksa kesuburan suami. Kita akan buat analisis air mani dan ujian hormon.
Boleh doktor?
Baik Encik Hakim, hasil air mani Encik normal. Volume, mortality dan morfologi semua okey. Tetapi, tahap testosteron Encik rendah.
Alamak, macam mana boleh jadi macam tu doktor?
Encik ada tekanan kerja tinggi ke? Letih berpanjangan? Pina nafsu?
Ya, saya kerja banyak dan selalu stres. Di video pun kurang hati-hati ni.
Tekanan emosi boleh mengganggu penghasilan hormon termasuk testosteron. Ini mungkin penyebab sukar dapat anak.
For Encik Hakim's condition, his semen analysis shows that Encik Hakim's levels of semen, mobility, and shape are all normal. However, he has low levels of testosterone, which could be caused by constant stress and fatigue that raise his cortisol level, where it is a hormone produced during stress. Thus, it will block the hypothalamic pituitary gonadal axis. As a result of this, there is a lower release of GnRH, LH, and therefore less testosterone is produced. Testosterone supports the body in producing sperm and also maintains libido. Thus, lower testosterone may reduce a man's urge for sexual intercourse and the regularity of intercourse, which could lower the chances of him fertilizing an egg at the right time. Now, let's see how ovulation and fertilization occur in an easy way. Ovulation starts when GnRH is released by the hypothalamus, which causes the pituitary gland to release two hormones, which is FSH and LH. FSH will allow ovarian follicles to grow and develop, where each one holds an immature egg. Growing follicle produce estrogen, which help the uterus get ready for possible implantation and signals the pituitary gland to lower FSH that the only follicle is matured. When estrogen reaches its threshold, it will stimulate the body to release LH, which is responsible for the release of a mature egg from the ovary. The egg then goes through the fallopian tube and for 24 hours it will be available to fuse with the sperm for fertilization. When fertilization takes place, the zygote will move into the uterus, which causes pregnancy. If fertilization fails to happen, the oocyte will degenerate. Remember, successful fertilization occurs when these hormones are released at the proper time and there is no issue with either the sperm or the egg. In men, LH causes Leydig cells in the testes to make testosterone, and FSH will help the testosterone to initiate sperm production. When both conditions occur together, which are PCOS in the female partner and low testosterone in the male, the chances of natural conception are further reduced. Since Puan Aina fails to ovulate regularly, her eggs are seldom available for fertilization, and this along with Encik Hakim's lack of interest in intercourse means that the chance of conception is rare.
Kalau begitu, macam mana nak mengatasi masalah ini, doktor?
Saya cadangkan cara mengatasi isu ini adalah dengan mengamalkan gaya hidup sihat seperti kaunseling dan terapi pasangan.
Pengambilan pemakanan seimbang dan bersenam.
Jika kamu berkeinginan untuk mendapatkan anak, kamu boleh cuba rawatan untuk mengatasi PCOS terlebih dahulu. Puan Aina hendaklah mengambil ubat untuk merangsang ovulasi ataupun ovulation inducing medication. Kehamilan yang berjaya bermula dengan ovulasi. Ubat-ubatan tertentu telah terbukti menyebabkan ovulasi pada pengidap PCOS.
Apa lagi rawatan yang perlu diambil, doktor?
Selain itu, pembedahan juga membantu untuk kamu berdua mendapatkan anak. Prosedur pembedahan boleh membantu memulihkan ovulasi dengan membuang tisu dalam ovari puan yang menghasilkan hormon androgen yang berlebihan. Saya menyarankan untuk membuat Assisted Reproductive Technology, ART. Saya mempunyai cadangan sama ada kamu untuk membuat IUI atau IVF.
Doktor, antara IVF dan IUI, yang mana lebih sesuai untuk kami?
What is IUI? Intrauterine insemination is a fertility treatment that involves placing specially prepared sperm directly into a woman's uterus around the time of ovulation to increase the chances of fertilization. So here are the pros of IUI. First, less invasive. Second, less expensive. Third, useful for mild male infertility. Next, cons of IUI. First, lower success rate than IVF. Second, risk of multiple pregnancy. Third, limited effectiveness for certain conditions.
So, what is IVF? IVF stands for in vitro fertilization, where it is a medical procedure used to help individuals or couples to conceive a child when they face infertility issues. The process involves collecting mature egg from a woman's ovaries and fertilize them with a sperm in a laboratory dish. After fertilization, one or more resulting embryos are transferred into the woman's uterus, where they may implant and develop into a pregnancy. But what are the pros and cons of using IVF method? For the pros, first, it helps people who can get pregnant naturally to have a baby. 2, it can be used to avoid passing on genetic diseases. 3, it allows freezing of extra embryos for future use. 4, it has highest success rate. 5, it can control fertilization. And the last one, it is suitable with various complex fertility issues. For the cons, first, it's more expensive and not always covered by the insurance. Second, the process can be invasive and physically or emotionally stressful. Third, success is not guaranteed. It may take several tries. 4, hormone treatments can cause side effects like mood changes or discomfort. So, there is a risk of ovarian hyperstimulation also.
Baiklah doktor, kami akan memilih IUI sebagai inisiatif kami untuk mendapatkan anak.
And now, at long last, they are welcoming a child into their life.
In conclusion, Encik Hakim and Puan Aina's story show that in most cases, reproductive issues are a combination of both lifestyle and biological risks. While Encik Hakim's semen parameter were normal, his testosterone level were low, most likely due to chronic stress, which played a role in reducing his libido and overall fertility potential. Meanwhile, the fact that Puan Aina was diagnosed with polycystic ovary syndrome indicate a serious hormonal imbalance that interfered with ovulation and cause problem with regular egg release. Examining the reproductive hormone parameter and the condition of both couples, the reason for the unsuccessful conception become clear. With medical intervention, lifestyle change, and assisted reproductive technology, in this case, intrauterine insemination, the couple nevertheless had a high chance of conceiving. Their experience show the importance of timeline diagnosis, mutual support, and informed medical advice. Their spirit of hard work and with the right treatment plan, they were finally blessed with a child, thus proving that even with fertility problem, there is always hope and science can help in creating a family.